Yes, hello everyone. This is Dr. Kampala, that's my name. Of course, thank you so much for always following up and watching these videos. So, in the topic of today, we are going to talk about hypertension. As we all know, hypertension is persistently elevated blood pressure. Of course, the blood pressure in the vascular system is supposed to be at a given value, but sometimes you find when it is elevated persistently and persistently. So as a matter of fact, this is alarming because when you look at these days, many of the people, hypertension is really becoming an issue everywhere worldwide. So let me tell you this, hypertension has got different types. Of course, you could be there. The reason that's why I encourage everybody to go and check their blood pressure is because you could be prehypertensive. In a prehypertensive state, you are sometimes not aware that at any point hypertension is gonna develop. So for that reason, go and check your blood pressure. So we have a prehypertensive state. So we also have hypertension stage 1 and stage 2. Of course, we also have pregnancy-related hypertension. Pregnancy-related hypertension, this is found majorly in mothers who are expecting, whereby their pressures become persistently elevated. Now, let's go into what are the causes of this hypertension and blood pressure. Where does it come about? Of course, I'm not going to combine the two because we have risk factors and the causes. Let me start with the primary hypertension. In primary hypertension, here an individual has an elevated blood pressure, but we don't know the cause. We don't know the cause actually. So for this reason, this is primary hypertension. So we also have secondary hypertension. In secondary hypertension, here, blood pressure is elevated, but as a result of an underlying condition. For example, you could be having a renal condition. Remember, the kidneys are important in the regulations of sodium levels and the water levels in the body. So if you have any problem with your kidney, your blood pressure is gonna be high and elevated. Secondly, we have endocrine issues, hormone issues. For example, in Cushing syndrome, here the blood pressure is elevated as a result of imbalances in those hormones and mineralocorticoids. So for that reason, the blood pressure will still be elevated. Thirdly, we have things like head injury. If we have any problem with head injury, or you've gotten an accident, or you've ever been operated, chances are high that you could have an elevated blood pressure. Cancer of the brain. If you have cancer of the brain, also you could, you see, so here you have hypertension, but as a result of an underlying cause, you understand? Then we have liver cirrhosis. In case, this is found in people who are chronic alcoholics, and they end up with liver disease, and liver progresses to cirrhosis, whereby the liver becomes so much hard. So here you could also have hypertension as a result of liver issues. Don't forget medications, contraceptive pills. There are contraceptive pills that have this side effect. By the time you go to check your blood pressure, you find it is elevated. So for that reason, as you utilize these contraceptive pills, please take note of that. It is not advisable to take them regularly for a long time. Actually, they were designed, yes, to be taken, but not as frequent as we think, some of us, because we have a habit of utilizing them for a very long time at a high frequency. We also have medications, for example, NSAIDs. NSAIDs contribute to an elevated blood pressure. So certain medication, you really need to Always get advice from your medical or your healthcare provider before you take anything. Because medication, a lot of medications outside there can end up resulting into an elevated blood pressure. You get my point? So we also have narrowing of the aorta or heart condition. If you have any heart condition or any heart disease, chances are high you're going to have an elevated blood pressure. Sorry for that. But let me tell you, there are some practices or there are some things we do that end up resulting into an elevated blood pressure. For example, of course, age is not modifiable. Sometimes as we age, with the time, as we age, tendency of getting high blood pressure also increase. You get? Because, see, here, the chance of the chances of getting issues with the arteries, especially arteries supplying the heart, increase with age. You get? That's why you see most of the people, as we age, we tend to get a high blood pressure. Because as you age, tendencies of your blood vessels also starting becoming malfunction, getting issues also become high. You get? So alcohol and smoking. If you smoke too much, and at the same time you are taking alcohol, trust me, you're gonna have an elevated blood pressure. So, of course, family history. Sometimes we get blood pressure not because of anything or what, but just because of the grandfather, the family lineage, people who have been getting high blood pressure. So we end up with inheriting those genes of having a tendency to have this condition of an elevated blood pressure. Another thing is obesity. If you are extremely so much thick, it means chances of having a high blood pressure is really high. Taking foods that are containing a lot of fat, at the end of the day, these fats, bad fats, the cholesterol, will end up clogging the blood vessels, resulting into increasing the resistance at which blood is flowing. So your blood pressure goes high. Not forgetting, we also have complications, because if the arteries are clogged with this cholesterol, it means they will end up blocking. So when it comes to small arteries, they will block. And when they block, we shall have a completely damage of vital organs. For example, the eyes. You could get an issue with your eye, vision, and sight just because of a high blood pressure. You get my point? So for that reason, it is advisable to always regulate and know how to manage certain things, especially when it comes to that. So stress, let me tell you something. You see, when you are stressed, there is a lot of changes that are going on inside your body. A lot of changes that are really going on inside your body. And these changes, in the end, they will result into issues. What your brain sometimes do, it starts producing certain hormones. All the time you are stressed, the stress hormones are in your blood circulating, it is blah, 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 blah. Every time, because of the stress you have, the blood pressure is, because when we are stressed, blood pressure tends to be high. And you are a kind of person who is busy doing a lot of work, you have a lot of businesses, you are all the time scared about your containers. As you can see, I am seated, this is the Nile, as you can see behind me here. So at a given particular moment, you are really going to have an elevated blood pressure, not because you want, just because you are always stressed. So please, get some time and relax, get some time and have time for yourself, you get? Another thing is high salt intake. High salt intake. You see, every single moment, most of the meals we have, most of the things we take inside contain high amounts of sodium. So you find at the end of the day, the amount of sodium levels you are taking are really very high. At the end of the day, you end this cumulative effect today, tomorrow, the other day, result into a very high blood pressure. The challenging bit with this blood pressure is blocking small arteries. For example, when it comes to do you know you could end up with a heart attack just because of high blood pressure? So, the arteries that are supplying the heart could get blocked. And when they get blocked, it means the heart itself that is pumping blood to the other parts and vital organs of the body is blocked. At the end of the day, you will end up with a heart attack. You get it? So for that reason, seeking medical advice and also stop smoking, lifestyle, do exercise, have a healthy diet. You understand? Have a healthy diet. And also regulate salt intake, then manage stress and pressure. Manage stress. Then if you know you have hypertension or an elevated blood pressure, please make sure as much as possible you go ahead to manage it from your healthcare provider, because sometimes most of the medication, it could be by lifestyle modification or medical management, and sometimes it could be surgery. For example, if you have a tumor, if you have cancer anywhere of the brain or something, it may require surgery. So for that reason, I highly encourage everybody to always manage their blood pressure. But also, if you know you have it, don't get scared. No, you can live, provided you are seeking the right medical attention. But thank you so much for joining. And I keep saying this, everybody that really wants to see me face to face or consultation, of course, you know, I'm based here in Uganda, Jinja, and the contacts are running below. You can come visit Uganda, Jinja, and have a beautiful time. As you can see today, I decided to talk about this when I'm just seated here behind. This is the Nile. The source of Nile is just there. And this is this. Otherwise, thank you so much for watching, and I encourage you to continue watching these videos so that we can change and create an impact. Thank you so much. I wish